The biggest study of its kind is offering insight into the blunt damage COVID-19 is doing to the brain. An early look at hundreds of people with mostly mild cases has found tissue damage and shrinkage of brain matter that people who have had the flu don't get. Kim Baker-Wilson reports.
Scans from hundreds of people and one key finding.
About 2% reduction in the size of those memory centres there.
COVID is damaging people's brains.
Surprised, I think, surprised.
It is really scary, yeah.
Scary because
in people that had been exposed to COVID, they had shrinkage of the brain, particularly in the memory centres and also some other regions of the brain, particularly around the memory centres and olfactory centres.
people who had the flu didn't show the same.
MRI is very accurate for detecting these brain changes, so it is something to take very seriously.
Those scans came from the UK Biobank, taken both before they got sick and again after.
The infected participants also had more difficulties, greater difficulties in performing complex tasks compared with those who did not get infected.
On average, a big cognitive decline between the two scans. It's being linked to atrophy in the brain.
Most studies so far have focused on seriously ill patients in hospital. What happens to the brain in patients who are less sick hasn't been known until now.
96% of the study's cases were classed as mild.
I think there needs to be recognition for long COVID as a disability, so people who are suffering the disease can get access to the benefits and their employers can be more understanding.
She still has health problems 2 years on.
I had dizziness and a lot of brain pain, which is very distinct from a headache.
Scientists say it's too soon to know if it's permanent damage.
It can get scary to hear about the fact that your brain has shrunk, but we need to bear in mind that the brain is really plastic.
The study's results are far more concrete. Kim Baker-Wilson, One News.